Pulse oximetry is used to measure the oxygen saturation in blood, or more specifically, the percentage of hemoglobin bound to oxygen. So, it is expressed in percentage. The normal arterial blood oxygen saturation levels in humans are 95 to 100%. Pulse oximetry reading is also expressed with the acronym SpO2. SpO2 does not mean any partial pressure of oxygen. It simply means saturation of arterial blood with oxygen or saturation of peripheral oxygen or pulse oximeter oxygen saturation or spot oxygen saturation. Sometimes doctors would ask the nursing staffs, how much is the SpO2? Or what is the oxygen saturation? Or even simply, what is the saturation? Or how much is the saturation? They all mean the same. The answer would be 98% or 95% or 80% as the case may be. Pulse oximetry is a very common, simple, and non-invasive monitoring technique. The probe is applied on fingertips or toes or ear lobule or even tip of the nose. In case of an infant, it is applied across the foot. Now let us look into how pulse oximetry works. Pulse oximetry works on the principle of Beer-Lambert law. Beer-Lambert law states that different solvents absorb infrared and red light at different wavelengths. A pulse oximeter probe emits two lights of different wavelengths. Red light at 660 nanometer and infrared at 940 nanometer. Oxyhemoglobin, that is, hemoglobin bound with oxygen, absorbs more infrared light, while deoxyhemoglobin absorbs more red light. This ratio of red light to infrared light is measured and converted into numerical value by a processor in pulse oximeter. For example, if the ratio of red light to infrared is high, which suggests deoxyhemoglobin, the saturation would be low. Now let us look into some of the uses of pulse oximetry. Apart from oxygen saturation levels, pulse oximetry also shows pulse rate of the patient, which is quite useful in case of intensive care units where continuous monitoring of various parameters are needed. Secondly, the photoplethysmography, that is, the variations in the amplitude of the pulse oximeter waveform, can be used to assess the fluid status of a patient and also responsiveness to fluid therapy. Pulse oximetry can also be used to check the presence of peripheral arterial pulsations distal to the site of surgery in the immediate post-operative patients, especially in orthopedic surgeries where the risk of injury to the arteries are high. Now let us look into the limitations of pulse oximetry. Number 1. Carboxyhemoglobinemia. Carbon monoxide has the same absorption pattern with oxyhemoglobin, so it will give false high saturation levels. And in case of methemoglobinemia, the saturation level is constant around 85%. And in case of severe anemia, there is underestimation of actual saturation values. And there is difficulty in obtaining saturation values or the actual values in hypovolemia or vasoconstriction, especially in cold environments. Vasodilatation, on the other hand, give a slight decrease in value. Nail polish, especially a blue color, show false reading. Shivering, dark pigmentation of the skin can also impair the oximeter reading. Another major limitation of pulse oximetry is that the pulse oximeter only measures oxygen saturation of arterial blood but does not indicate tissue oxygenation, which is indicated by the mixed venous oxygen saturation. Last but not the least is that now there are different kinds of pulse oximeter available in the market. A fingertip pulse oximeter, or the one which is attached to a multi-para monitor, and some special types of oximeters like co-oximeters, which can differentiate between normal and abnormal hemoglobin. Thank you for watching.